Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us for another segment. For patients suffering from chronic pain or movement disorders who don't live close to a care provider or have difficulty accessing care for a variety of circumstances, well, a new first-of-its-kind virtual technology has the potential to, increase access to optimal treatment. Joining us is Dr. Juan Ramirez and his patient, Darryn Wright, with more. Welcome both Dr. Ramirez and Darryn. Thank you for joining us this morning.
Thank you for having us. Thank you for having us.
Dr. Ramirez, if you could give us a look into your professional background, tell us where you're practicing right now and in what capacity. And then, Darryn, if you could give us a look into your life as well.
I am Juan Ramirez. I'm a neurologist and movement disorder specialist. I am the director of the Parkinson's Disease and Movement Disorder Clinic at University of Texas Health San Antonio. I'm Darryn Wright. I live in the DFW area, North Texas. Service manager during the day and part-time woodworker at night and on the weekends, and hanging with my family and grandkids and stuff like that.
Dr. Ramirez, what exactly are you treating Darryn for?
Darryn is one of my dearest patients. He has Parkinson's disease, which is a neurodegenerative condition that comes with motor and non-motor symptoms, and I have been treating him for a few years now with traditional treatment, and eventually he upgraded to advanced treatment with deep brain stimulation.
Darryn, what was going on in your life when you were diagnosed?
The main thing that was happening was I was just getting real slight tremors. It kind of started with a tremor in my right foot on the gas pedal driving home, and I could move my foot and stop it, so I didn't think much of it. And then they just kind of slowly progressed, and then one night my wife noticed my hand shaking, and she asked if I was doing that on purpose. I said no. And so, she's a nurse, so she jumped right on it and got me an appointment. And anyway, things went from there, and I was diagnosed with Parkinson's disease in April of 2014.
Is there any pain associated with your tremors?
Yeah, there can be, because, and that's one thing people don't realize, Parkinson's is painful. It's not just the shaky disease or whatever. One of the issues that can come with Parkinson's is called dystonia, where your muscles tighten up. And my big issue, especially when I was trembling in my right arm, is my hand would just want to close up and my fist curl in and just tighten up all my forearm muscles and stuff. So that would get very painful, especially if it was continuing on throughout the day, and then also getting cramps and things like that just randomly in places, and they aren't cramps that just go away right away. They stay with you for a little bit.
Dr. Ramirez, are these symptoms that most people are unaware of until they're diagnosed or become a caregiver to someone who's living with Parkinson's?
Yes, there's a variety of symptoms, and for a lot of people that maybe we're not considering Parkinson's disease as a potential diagnosis, once we are able to evaluate and maybe confirm it, it becomes like that aha moment where they are able to put all of those different symptoms together and maybe attribute it to the same condition. However, in other situations, we have patients who come to see us already with the dread or the concern about having that specific diagnosis. So like anything, there's usually patients that are very well aware and that have done the research and they know where those symptoms may be leading, and there's others that may not have a good idea. But like anything in life, there's multiple varieties and forms of manifestation of this condition. So really not everybody is the same, which is very important in considering the type of treatment and how everybody responds to the available management that is out there for Parkinson's disease.
Darryn, after your diagnosis, were resources readily available to you in your location, or did you have to struggle for transportation? I hear Dr. Ramirez talking about patients that come in to see him.
Yeah, at the time, when I got diagnosed, there's a lot of great resources around me, support groups and exercise programs and various things like that. And when I was diagnosed, I think I went with Dr. Ramirez a few years after being diagnosed, and
But fortunately, we were in the same area at the same time. I was still living here just outside of San Antonio, so I had no issues as far as getting to appointments and things like that. But that definitely can be a problem for people that may not be able to drive or don't have someone to take them to the office.
Is this a problem that you have encountered, Dr. Ramirez, with some of your patients once they come to see you having trouble returning for follow-ups?
Definitely. In the area that we are located, in Texas, in one of the largest states, we have very wide coverage where we have patients that travel miles and miles to see us. A lot of the times we have to customize their treatment, considering that they might not be able to come to the clinic. Distance is one factor. The other factor is, me being a movement disorder specialist, most of the patients that I see are in the older age group, and some of them may not have family around, caregivers, some have very limitations as far as how they physically can get to the clinic. And then the other thing is, even with all of that in place, sometimes, our clinics are extremely busy, and finding the logistics to squeeze in a patient who already has only limited options as far as when they can come, because that's the only time that the daughter can come. So that's very, very complicated. So the logistics of getting a patient to the clinic, whether it's just because of lack of a caregiver or distance, is extremely limited. However, one of the only good things that I can see coming from COVID is that it has facilitated, especially in my practice, the ability of using virtual clinics or virtual medicine, and that has been a game changer for healthcare.
How does Abbott's new NeuroSphere Virtual Clinic work to alleviate this problem of transportation and availability of quality care?
So for patients who have these chronic movement disorder conditions, patients with Parkinson's disease, essential tremor, who have deep brain stimulation in place, historically, the only way that we could manage that and do the changes in programming that are necessary would be for patients to be physically there in the office with us. However, with Abbott NeuroSphere Virtual Clinic, that is not an issue anymore. So for patients with this system, we are able to connect remotely, virtually, through a very safe platform where I can see my patient through the platform, I can interact with them, I can do a physical examination, and depending on that conversation, I'm able to come up with a treatment plan and changes on the programming of the stimulator, which I do it in my office through the platform. I change different parameters that the stimulation allows us to, and that directly translating to my patient getting those upgrades, those new settings wherever they might be, at the office, at home. And this is a tremendous advance, I believe, and especially in an area and a practice like ours where we can offer and see patients more often. I even think that moving forward, this will allow to get the outcomes that we get maybe in a shorter time, because usually with the distance and the transportation as a factor, sometimes we have to spread those visits farther apart. So I think virtual clinic and the virtual world that we live in now has come to an advantage, and it really helps in healthcare.
Darryn, briefly describe how the Abbott NeuroSphere Virtual Clinic has helped you manage your treatment.
Yeah, absolutely. 2 years ago, I moved up to the Dallas area, but with my employer, I told them I wanted to keep my same doctor for my Parkinson's, and they were on board. Since Abbott's come out with the NeuroSphere Virtual Clinic, we've been able to do visits. One we did recently right in my office. Dr. Ramirez was able to access, make changes to my simulator, and still go through the whole neurological exam and everything. And it was nice because I didn't have to waste basically a day and a half of driving down here, going to the appointment, and driving back up. We were able to do this in 30, 35 minutes, 40 minutes, something like that.
Excellent, excellent. Dr. Ramirez, where can our listeners learn more about this new technology?
So for people that are interested in exploring into deep brain stimulation, I always tell them to access their healthcare providers so they can direct them specifically. In regards to the Abbott NeuroSphere Virtual Clinic, they can find more information at the website, abbott.com, where they can find very specific information about this modality of treatment.
Dr. Ramirez, Darryn, I appreciate both of you joining us here on the program this morning. Thank you very much.
You're very welcome.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Juan Ramirez and Darryn Wright. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.